I am pleased to propose this joint motion, which has the support of all opposition parties and most independents in this chamber. This is a significant motion that demonstrates a collective acknowledgement of the disability and dementia funding crisis. I want to commend my party leader, Mary Lou MacDonald, for taking the initiative to invite all parties and independents to come together on this issue. It is disappointing, however, that none of the government parties responded to this invitation. Now, since mid-March, services and respite services were closed or day services, and respite services were closed as were most other sectors in society. And this proved difficult for many people for a variety of reasons, but I think it is fair to say that people with disabilities were disproportionately affected. And many service providers have told me how they have noticed since reopening that those they care for have regressed over the last 6 months. This sector has been extremely slow to reopen through no fault of its own, with most services not resuming until mid to late August or into September. Day services such as training and education facilities are only operating at roughly 40% capacity pre-COVID, again through no fault of their own. So I wish to commend service providers for the terrific job they've done both during the lockdown and since reopening. But when consulting with service providers and advocacy groups, they have identified a number of challenges which are prohibiting the full reopening of services. And these challenges are transport, accommodation, staff and COVID-related costs such as PPE. Now, the issues around transport are as a result of the 2-metre rule, which means that only a small number of service users can travel at one time. And even if this is reduced to 1 metre, it will still present a problem. For example, a bus which could have carried maybe 15 people pre-COVID would now be able to only bring 5 people in total. And this means that either the number of buses or the number of runs a bus does is increased. Now, either way, investment is needed to cover the cost of hiring another bus or asking existing buses to do additional runs. So I want to point out that some service users are not being offered any form of transport whatsoever and are dependent on family members to bring them to the day service, and if that is not possible, are unable to avail of services. While some premises are sufficiently spacious to allow social distancing, many are not, and funding needs to be provided immediately to enable services to acquire additional space where needed. Now, the staffing issue is huge. As a result of distancing rules and in order to accommodate all service users, additional staff is needed in practically every service. And some services have sufficient physical space to allow all service users to attend, but more staff are needed as those attending services will be placed in pods in order to comply with public health guidelines. They also have the added burden of replacing staff that may have to self-isolate. Many services have had to resort to employing agency staff, which has proven very costly. And the ongoing issue of Section 39 pay restoration means retention of staff is also impacting harder as a result of COVID. People in residential units cannot attend day services, so staff in residential units must provide the day services here too. Service users with underlying health conditions cannot attend services, so home supports should be provided to these people, but again, staff will be the main problem. There is also an urgent need for infrastructure, home care and community support for people affected by dementia, and their sense of abandonment runs deep. Every service has spent a substantial amount of money on PPE and sanitation, and providers have not been recompensed for this and have no idea if they are going to be. Business cases for COVID-related expenditure were submitted to the HSE in June, and the sector estimates that the true cost of COVID is €120 million. Yet government has yet to provide any funding to meet this additional burden on services. Respite provision too has been suspended and again only opened at a much reduced level recently, if at all. People need a break. For 6 months, people with disabilities and their families have been trying to cope in what are sometimes impossible circumstances. I also want to note the current inadequacy of provision of personal assistance hours for people with disabilities, and this inadequacy needs to be urgently addressed. What I have outlined are the immediate challenges facing the full reopening of day services in respite and community care. And as we know, COVID will be with us for some time. The necessary funding to allow the acquisition of additional transport services, accommodation, staff and other essentials needs to be made available immediately. The response to the Minister's meagre €10 million funding announcement last week was met with shock and then dismay by the disability sector. I shouldn't have to remind the government parties that policy development and funding of disability services must be rights-based as determined by the state's obligation under the United Nations Convention on the Rights of Persons with Disabilities. There are numerous reports on the implementation on what needs to happen, but very little has. Immediate action is needed across all departments to ensure, for example, accessible transport, a move away from congregated settings, to suitable housing for independent living in the community, educational supports to allow people with disabilities full access to education, more employment opportunities for people with disabilities. So I urge you to support this motion.
I just want to commend my colleague Deputy Tully firstly for bringing this forward. So people with a disability and their carers have been relegated, unfortunately, to second-class citizens in this state. In every single sector, there are delays, waiting lists and a complete lack of services in many cases. It has become acceptable and the norm for people with a disability to have to fight for every single service that others take for granted. And I'm particularly referring to schools, school places around ASD classes and transport for both schools and adult day services, and also in relation to NEPs and the fact that schools have to battle for a handful of appointments every year and have to try and pick the children that they feel need this the most, a very impossible situation to be placed in. I want to particularly draw attention to an issue in the Carlow and Kilkenny region around the provision of occupational therapy, speech and language therapy and physiotherapy, particularly for children. There is an average wait time of around 18 months to 2 years for an appointment. There's long delays as well in assessments, and often people will be delighted when they finally do get an assessment, thinking maybe now we'll finally get our services. However, as I say, in often cases it's 18 months to 2 years for a follow-up service, and many people are saying to me that they are getting one appointment per year. I want to stress that this is not down to any existing staff who are working in that sector, who I honestly don't know how they keep going and how they keep the morale going when all they see is growing waiting lists of kids. We definitely need greater investment in this area immediately, and I'm asking Minister for you to specifically look at this situation in Carlow and Kilkenny. And when I was thinking about this earlier, I was thinking about how there's been a lot of media attention recently on the appointment of special advisors and maybe additional advisors. And when those roles are vacant or there's perceived to be a need for that role, immediately it can be filled. However, we have obviously waited years for occupational therapists, speech and language therapists and physiotherapists to help the children in the Carlow and Kilkenny region. I want to talk about the optional protocol of the UN CRPD. We really need to ratify this without delay, as this is the only way the state is finally going to sit up and take action, because it will be forced to do so. They're the points I want to make. But Minister, I am appealing to you because I do feel that you want to do the right thing here, and I've seen some statements that you've made since taking over this role, and I really do hope that you will follow this up with action and do the right thing by everybody with a disability and their carers, because they are totally exhausted and they do need assistance and they need funding and investment. It's been underfunded and underinvested for years, and COVID has highlighted that and thrown it into stark contrast. And now we have a situation where people are trying to reopen services. If you finally get a place or you get a couple of hours, next thing then you're here, there's a battle for transport. So there is major issues there to be addressed, and I don't think anybody is looking for an overnight solution, but they do want to see that it's been taken seriously and that action is actually, and there's stuff going to be delivered for people. Thanks, Laska and Carla.
Moving back now again to the Minister. Thank you, Laska Hirlik. I want to thank the deputies for raising this motion in the House today. Although I will be opposing the motion as it is set out this evening, I welcome the chance to restate this government's commitment to supporting people with disabilities and their families, particularly at this time when we are dealing with the consequences of COVID-19 pandemic and the current restrictions it causes. Laska Hirlik, I want to start by acknowledging with sincerity how difficult the last few months have been for people with disabilities and their families. The impact of COVID-19 on their lives has and continues to be very significant. I am very aware that families across the country have had their routines upended. COVID-19 has presented a huge challenge to our disability services. While we all want our services to return to pre-COVID levels, the collective aim of the Department of Health, the HSE, the service providers, has to be to restore services in a safe way. Tonight, I would like to outline the significant work that is underway to achieve this. The HSE provides and funds a range of day services and rehabilitative training. We engage with approximately 19,000 adults with disabilities in almost 1,000 locations across the country. These services are essential for adults with disabilities who avail of them and their families. As the House is aware, because of COVID-19, the majority of the disability day services closed in March. They have now reopened. However, they have not resumed at the level that they would have been pre-COVID. The impact of social distancing inevitably limits the number of people that can be present in any service, as well as the numbers in community settings. Last Concearloch, I can completely understand the intense frustration of the day service users and their families at this moment. I really can. The fact that day services have not resumed the pre-COVID levels is far from ideal. My office has been inundated with queries about adult day services. The main question people ask me is, when will services increase? Answering the question has been my absolute priority since taking office. I was pleased last week to announce the 10 million being made available in 2020 to support the resumption of adult day services and enhance home support for people with disabilities. Of this funding, 7.5 million will increase the level of day services by 1 day a week for over 14,000 adult day service users. The resumption of day services has been a very welcome and hugely necessary development for service users and their families. The additional day of service it will provide is a step in the right direction. It will improve the situation for people using day services and their families as we face into tougher winter months. Ongoing challenges that we face are things like the physical limitations of the buildings available and the continued restriction of social distance guidance. The HSE is building increased capacity for day services and will maximise the support that can be provided with these restrictions. The allocation of additional funding to day services is only one way of addressing the complex barriers to the full resumption of services. Children's services, respite services and adult day services are all resuming. They have been reimagined and redesigned to be delivered in line with the new HSE guidance. Crucially, Government's intention is that, similar to schools and creches and disability services, will remain open at each level of the resilience and recovery framework, subject to public health guidance. Residential services for people with disabilities have continued throughout the pandemic. About 3/4 of those in disability residential care live in group homes in the community. The remainder are in congregated settings or campus settings where there are 10 people in a group. Smaller settings have proved to be safer when it comes to COVID-19. Other protective factors are a shared proactive response to the public health teams and service providing working together. People in disability service, on average, younger than those living in nursing homes, but they do not have an on-average number of people with clinical conditions. Those conditions could increase their vulnerability to serious illnesses if affected. Sadly, 13 people living in residential disability services have died due to coronavirus. There have been no further deaths since early summer, but that does not allow for complacency. We owe it to our vulnerable family members to observe public health guidance to keep this figure as low as possible. We must also remember that these residential facilities are people's homes. We must not forget that, nor should we forget, the importance of maintaining family connections with loved ones from a holistic, person-centred approach. The Government recognises that there is a need to address the financial sustainability issues facing the disability sector, and so Government is committed to publishing the Disability Capacity Review. We also intend to use the recent research into the cost of disability to individuals and families to properly inform direction of future policy. However, moving forward towards a more sustainable model of service provision, we will also mean finding out what factors are causing sustainability challenges. And I would encourage disability service providers to work with the HSE to address these underlying issues. Investment in disability services is significant. with an overall budget for disability services exceeding €2 billion in 2020, with additional funding allocated to meet COVID-associated costs dealing with COVID. The HSE has consistently worked to engage with individual service providers who are having difficulties in service provision and sustainability due to historical financial deficits and new financial challenges. The House may recall that over the summer I asked the HSE to relieve Section 38 and Section 39 disability service providers of the obligation to achieve the 1% cut. This was to ease the burden of provider services challenging in the context of COVID, which was worth €20 million to the sector. I do not underestimate the scale of these challenges, and I have previously acknowledged the commitment of these services in supporting and protecting those with a disability who attend health and social care settings. When I addressed the House last month during statements on disabilities, I mentioned that my colleague Minister O'Gorman and I had asked that the establishment of the proposed joint Oireachtas Committee on Disability Matters be prioritised. I am pleased to note that this will be happening very soon and that our colleague in this House, Deputy Michael Moynihan, has been appointed chair. I know he will be an excellent and dedicated chair. I advocated for the establishment of such a committee. I believe it's our responsibility as public representatives to hear from people with disabilities, their families and their advocates. Legislation and policy have to be sculpted with their input. I understand exactly why this motion is here before us tonight. Absolutely. And I understand and I feel the frustration of the families, their advocates and the service users. But it's also important to realise that when I took office last July, all these services were closed. We have worked with the Department and the HSE to slowly, working within guidance, to ensure that the services could open up and keep people protected. I have travelled around the country. I started off in St Joseph's in Charleville, where I discussed Cooleen's house in relation to respite. I travelled to Wexford, I travelled to Kilkenny, I've been in Galway, I have been around, I've been listening, and it's the same repeated issues that are coming up. The same repeated issues that are coming up. Yes, you are right, Pauline. It has been staff, it has been transport, it has been accommodation. But we could not turn on the light switch either overnight to ensure that this did happen, because we had to have staff, we had to find the accommodation. It has to be to a HICWA requirement. In order for it to work, it has to be done on a piecemeal basis, and that is happening. And to be very fair to the providers, they have worked with the HSE and they have worked with the department. Only as of yesterday, when I talked with Paul Reid, I understand exactly that no longer will I have to rely on the likes of respite units now to be isolation hubs. They are being stood down, and the HSE are going to ensure with their €5 million that they will ensure that we have isolation hubs, that we no longer have to draw on valuable respite services to ensure that services and people are protected. So to finish, I think it's worth noting that when you add up the €20 million saved from the scrapping of the 1% cut, the €10 million from the reopening of services, and the €7.8 million to tackle the assessment of needs backlog, I have secured a €37.8 million investment in a sector since I took office 98 days ago. And to think that that is small money, it is far from. Every euro, and you know this, every one of you in the House, the disability sector is the poor cousin when it comes to health. So for me to have secured €37.8 million, I fought for every euro of that, for the disability families, for the service users and for the providers, and for the children that are sitting there on a backlog of a needs of assessment. So, last Ceann Comhairle, this is a clear demonstration to this government's commitment to the disability sector and a tangible example of my commitment of fighting for the people with disability during my time in office. Ceann Comhairle.
I just want to thank all of those for their contribution tonight to this very important debate, and to say again just how disappointed I am by the response of the government parties to this motion. Because I know you, Minister Rabbitte and Minister Butler and Deputy Moynihan, I know that you are just as aware as any of the rest of us are of the circumstances that people with disabilities or people with dementia and their families are in. And you have been informed of the difficulties they face daily. And we all know that tea and sympathy isn't just what they need. They need action, and it is time to do the right thing. Now, I do welcome the fact that you said that a commitment has been made to keep day services open despite what level we're on, because that is absolutely important. And I know safety is paramount as well. And that's why so many of the services are in difficulty, because they are adhering strictly to the guidelines to keep all of the service users and their staff safe. But people with disabilities feel, and I suppose it's not for the first time, that they are the forgotten people in this state. I mean, the 10 million allocated last week, to be truthful, it was met with dismay and disappointment, and indeed disbelief by some people within the sector. Others would have said, well, look, they've got used to it, they don't expect anything different, they expect to be forgotten. Funding was made available to open our schools, and rightly so, but a similar amount of funding is needed. I think it's 120 million is what's suggested is needed to cover the cost of COVID and to open services fully. If we were to rate our country, and this has been brought up a few times by other people here, on how it treats its most vulnerable citizens, I think we would be pretty low down on that, and that's all of us together. I'm sure you are familiar with the facts on disability in the country, and many of them have been alluded to here. But we have over 640,000 people with disabilities, and that's expected to rise by 20% in the next 5 years. So we need to ensure that the services provided for people with disabilities are there to meet their needs. We also, as it was spoken about, has the lowest employment rate for people with disabilities, and it's 20% lower than the European average. And I meet parents who say, my son or my daughter, they're after qualifying in college, but maybe because they're on the autism spectrum, next thing they go for a job that they're highly qualified on paper, but people don't want to employ them. So we need to do more to secure employment for people with disabilities and ensure, I suppose, the quotas within the public service are met as well. And there are incentives for employers that maybe they're not aware of to hire people with disabilities and to make them more aware of those. So I just think it's time to properly fund the services and supports for people with disabilities. Now, initially it is to fund the shortfall in the COVID funding for services, but I do think there needs to be a change in focus on how supports for people with disabilities are provided. And the optional protocol has been mentioned here several times, and that needs to be adopted and implemented. I mean, there have been many reports commissioned on how rights could be guaranteed. And these reports are gathering dust. So we know the right way forward, but it just hasn't been implemented. It hasn't been acted upon. I also said, you mentioned that the results of the capacity review will be published soon. So I'm just wondering, is that imminent, or when that will be? Because it's very important as well, that we know what the shortfalls are and what are needed. So I know you've said you're putting forward an amendment to this. I'm urging you to support this motion instead.